and welcome to Colores Latinos TV. I'm Nancy Peña. Thank you for joining us. Today we have a very special guest, Mark Kennedy, Senior Program Manager of the Chronic Disease Prevention and Control Division from the Boston Public Health Commission. Mark, thank you for being with us and welcome to Colores Latinos TV.
Nancy, my absolute pleasure to be here.
Thank you. We invite Mark today because, as you know, we usually discuss different topics in Colores Latinos TV. We talk about health prevention, we talk about culture, and also we talk about education. So we are going to learn today with Mark about how men can be healthy and also prevent certain issues about, meaning prostate cancer or prostate issues. So my first question to you, Mark, is how men can be healthy in terms of the prostate?
It's a good question, and Nancy, I wish that men would actually take it more seriously. Men need to talk about it more, men need to be more aware of this part of their body. There are a number of things that men should know. First of all, this is something that you can maintain the same way that you go to the doctor for a routine annual physical to check your blood pressure or your cholesterol levels and things of that nature. The prostate is part of a man's reproductive system. So women don't have prostates. I want to make sure people are clear about that. And in order to understand the health of a man's prostate, he needs to go to a doctor and have a screening test done. And actually, there are two ways to screen. One is a blood test. It's referred to as a PSA, which stands for prostate specific antigen. All that basically means is that there's a particular protein that's only produced by the prostate that is given, if you will, to the man's bloodstream. There are normal levels of PSA in the blood, and there are elevated levels of PSA in the blood. So men should test periodically to make sure that their PSA levels are correct. And if they're not, it could be a sign of any number of different things. Men, as you know, produce the male hormone testosterone. And if there is too much testosterone in a man's body, the prostate begins to grow. Or it's not so much if there's too much, it's just that testosterone will promote the growth of the prostate. So if the PSA level is high, it could be an enlarged prostate, but it could be a sign of other issues, say an infection, an inflammation, or things of that nature. But it's a signal to the doctor to do some additional testing to see what the problem is, correct that problem, and then test the PSA again to make sure that it's gone back down to normal levels.
What symptoms do you think that men should, have in terms to think like, oh gosh, I need to go to the doctor now?
Yeah, that's an excellent question. As men turn around 40 years of age, what they'll notice, if they're anything like me, is that the way that they urinate is going to be different. They're going to notice that they're going to the bathroom more often. Mm-hmm. They're going to notice that the stream, if you will, is going to be slower. They're going to notice that they maybe, when they get up, or when they go to bed at night, they'll be getting up 2, 3, sometimes even 4 times to go to the bathroom, so they're not getting a full good night's sleep. If men begin to notice that that's the case, that's when they should begin to talk with their doctor about how they can be aware of and maintain good prostate health.
As we were talking before we started to record today, I tell you then, of course, we have, I have brothers, I have father, grandfather. As a woman, I can tell you then we really cares about others all the time, right? So usually I can see that when one of my brothers or somebody in my family that is a man is sick, it's really hard to bring them to the doctor. They don't want to go to the doctor. Most of men that I actually know, I know that they don't really like to go to the doctor. Why?
Well, remember, Nancy, that we live in a very interesting society, and societal perspectives, if you will, on what it means to be a man are things that represent strength, things that represent this sort of macho kind of attitude. The other thing is that men are socialized to be providers in home, so they're about working every day to make sure that they can provide for themselves and their family. So when men aren't able to do that, they consider themselves weak, and they're afraid maybe that others consider them weak. So they don't want to show signs of weakness. So going to the doctor somehow has become, I think, in a very confused way, associated with not being able to be the prototypical, perfectly healthy, virile, and strong man, as opposed to doing the things that you should be doing to maintain the ability to be the most virile and strong man that you can be. I view it the opposite, as I was just trying to make the point. If I want to be the kind of man that society thinks I should be checking on myself. I should be making sure that I'm strong enough to work every day. I should be making sure that I'm strong enough to maintain and support my household. I don't see how men think they can do that without having a regular relationship with a doctor that makes sure that they know what's wrong, what it means to fix it, so that they can maintain that virile, macho, strong persona that society thinks that they ought to have. So I think the perspective actually should be reversed, but I think that most men just don't see it that way.
Interesting. We are going to go back to the first point you were mentioning about regular screening of the prostate, because that's the main topic. So you mentioned that when men are starting to think some kind of symptoms like urinating more often and going to the bathroom more regularly, they need to go to the doctor. What kind of screen they will have in terms to check the prostate?
It's an excellent question. So there are two ways that a doctor will screen for the health of the prostate. As I mentioned, the blood test, the PSA, which indicates the levels of PSA in blood. That's an effective test because it tells a man so much about what's happening in his body that is what I'll call conditions related, only one of which may be cancer. Okay, and we haven't really gotten to talk about prostate cancer yet. But the thing that I want to say is that as a natural part of being a man's prostate grows over time. That's because of the production, as I mentioned, of testosterone. But men are also prone to an issue called prostatitis, which is an infection or inflammation in the prostate. Men are also prone to urinary tract infection because if your urinary patterns change and you're not voiding urine as frequently as you should, you have urine that sits in the bladder, and that can cause an infection. And then sometimes some of that urine actually sits in the middle of the prostate, and I'll talk about that in a second. So you're prone to these infections or some of these other conditions, and if you're not checking on a regular basis, those things can lead to fevers and things of that nature. But those things are obviously with antibiotics and things of that nature, those are easy to take care of. So if men are experiencing any kinds of issues with the way that they urinate, if they're noticing that things are no longer the same as they were when they were young, they should at least be having a dialogue with their doctor about making sure that they're staying on top of checking that part of their body to make sure that everything's functioning properly.
They're going to the doctor and they get these tests, and they can, let's say, they can cure an infection, or they can prevent prostate cancer also. Because if they delay that treatment, if they delay to go to the doctor, now this issue, if they forget about this issue for a year or something, can lead to prostate cancer.
So here's the way I respond to that. If we're talking about issues like, say, an infection, an inflammation, there is no physical connection between having those conditions and then eventually getting prostate cancer. They're very separate things.
Important to clarify that.
So the PSA indicates, because if it's elevated, it indicates to the doctor that there's something going on in the prostate that needs to be identified. So the PSA is giving you an indicator that there is a condition in the prostate that needs to be identified and followed up on so that it can be fixed. And it could be any number of different things that it would indicate, some of which I just mentioned to you. None of those things will automatically predispose a man to get prostate cancer. But again, if you leave those conditions unchecked and they get worse, it creates a level of discomfort and a reduction of quality of life for men that they just don't need to live with as long as they go to the doctor and get these things identified so that they can get them treated.
Excellent. So now we are going to talk more about, prostate cancer. So
Okay.
now that we learn about what kind of infections men can have in prostate, right? And we also learned with Mark that it's important for men, all men, to go to the doctor regularly. At least to have the annual physical, right?
Mm-hmm.
And to see if they have any other problems. And also for family members, women or friends to support them, because as you mentioned at the beginning that men, it's important for them to feel like responsible, and then they're providers. And but on the other hand, if we don't, if we don't encourage them, if we don't tell them go to the doctor, we don't bring them or go with them. Sometimes they want to be with somebody, because I believe they can have the same fear like any other body has when they go to the doctor for a checkup or something. So I think it's normal. However, perhaps they are not going to say that. Of course, we as a woman, we can say that, I'm afraid. But Ben has a different culture. It's a different culture, and we have to understand that. And also, we see many advertisements in the TV and other platforms supporting a lot women, but we don't see a lot of support for men.
That's right.
And that's why here in Colores Latinos TV, we really care not just about women or kids, but also about men. And that's why we are bringing this topic to you today. So let's dig a little bit more about prostate cancer. Can you explain more about that, please?
Absolutely. So let me start by saying one other thing about the way that a man's prostate changes over time. We talked about testosterone. We talked about the growth of the prostate. We talked about prostatitis, urinary tract infection. One other thing that I want to make the public aware of is a condition called BPH. The regular language term, if you will, is enlarged prostate. BPH stands for benign prostatic hyperplasia. The reason why I want people to know the technical term is because of the word benign. We're talking about a non-cancerous growth of the prostate. That's a condition that every man will have if he lives long enough. Again, if you turn 40, then if you don't already have an enlarged prostate, you're pretty close, okay? And that's going to cause some of those urinary problems I talked about. Benign prostatic hyperplasia or enlarged prostate doesn't lead to prostate cancer. It's a condition that men should be aware of that causes some of those symptoms that we talked about. So cancer is an interesting thing. A lot of people may or may not know that in our body, we produce cells that have functions in the body. The cells live for a certain period of time, they die off, and then the body replaces them with new cells. The body is a wonderful machine, but like a lot of machines, sometimes it breaks down or goes haywire. With respect to cells, sometimes that natural life of cells becoming new, they live when they're supposed to live, they die when they're supposed to die, and then the new ones replace them. Sometimes that process doesn't work quite right. Sometimes the cells that are supposed to die don't die. Sometimes the cells that don't die connect with other cells, and then they form tumors. The tumors behave very differently than normal cells. Normal cells stay where they're supposed to be and do what they're supposed to do. The tumors, when you accumulate all of those things that aren't supposed to be there, begin to move around in the body, and they get in the way of functioning of other parts of the body. Those tumors are basically what cancer is. When we refer to prostate cancer, The same way we would refer to breast cancer or lung cancer. It's about where the process that I just explained started. So when that process of cells not behaving the way that they're supposed to starts in the prostate, we call that prostate cancer. The prostate is a gland. If you look it up, if someone Googled it, they would see that it's this walnut-shaped gland and about the size of a walnut. But that's when men are in sort of their puberty age, so mid-teens. So as I mentioned before, the prostate grows, right? We need to know, first of all, is the prostate growing only because of testosterone, or is it growing because there's a second mechanism in there, which is the tumor, and that's also growing and causing the enlargement of the prostate. Prostate cancer is mostly what we call indolent. I want people to begin to learn a little bit of vocabulary. Indolent means non-aggressive. Most prostate cancer is not going to kill a man, okay? So it's important to understand the difference between aggressive disease and non-aggressive disease. But you don't know what kind you have as a particular individual unless you check. The way that you check, again, is through PSA. So if, as I mentioned before, the PSA is elevated, the doctor will look at all of the non-cancerous reasons why the elevation could be occurring. And if all of those things have been ruled out and a man still has an elevated PSA, now the doctor begins to think about maybe this could be prostate cancer. Okay, so I don't know if I answered your question.
Of course. It's interesting, yeah, because first of all, you know, you are describing why prostate cancer can be developed. And second of all, you also talk about we don't know, men is not gonna know that answer until they don't go to the doctor to check it out. So my next question to you after this short pause is, who are what communities are in a higher risk? So Mark is going to answer that question after this break. Thank you.
Vamos, Juan, tu asignación.
Ya saben, solo comida enlatada.
Si al mundo tú quieres cambiar, haz lo que quieres realizar. El corazón lo hay que dar, ya es hora de empezar. Necesitamos el amor.
Gracias.
Sigue el amor, abre el corazón. Un poquito de amor, sí, de amor, amor. Necesitamos.
Hello and welcome to Colores Latinos TV. I'm Nancy Peña, and in our studios we have today Mark Kennedy, and we are discussing about prostate cancer. So my question was, Mark, who are in a higher risk of prostate cancer? What communities?
Well, generally speaking, when you see the numbers, there is overwhelming evidence that men from the African American community are at the highest risk for prostate cancer, and it's not even close. If you look at the incidence of mortality for black men compared to white men, black men are typically diagnosed with prostate cancer about 60% more often. So for every one white man that's diagnosed, it's about over 1.5 black men that's diagnosed. From the standpoint of mortality, it's over twice as many. So for every one white man that dies from prostate cancer, over 2 black men die from prostate cancer. The African American men, far and away, are at the highest risk from an ethnicity perspective from prostate cancer. Second is white men, and a very close third, in fact some would debate whether or not these numbers are actually correct, is Latino men, okay? So that's sort of the rank order. We find that people that live in the Western Hemisphere, so when you talk about Western Europe, and then moving further east to, to the United States, the incidence is very high. Once you go the other way, through Eastern Europe and then into the Middle East and Asia, the incidence goes down precipitously. We think that's because of diet. We think it's mainly because of diet, but we know that the Western Hemisphere has a much bigger issue from an incidence and mortality standpoint from prostate cancer than the Eastern Hemisphere.
For example, if we have a family member who just had been diagnosed with prostate cancer, how we can support them as a family members, and what kind of treatments this person can have?
Yeah, so the way to support them basically is to encourage them to get the screening, encourage them to be diligent about the things that they do for their health. If a man is unfortunately diagnosed with prostate cancer, the two main types of treatment are surgery and radiation. So surgery is complete removal of the prostate. And unless a man is trying to have children, there really isn't a need for your prostate. It's not like your heart where you actually have to have it. It's almost more like your appendix.
Okay.
You can actually have that removed. The other major treatment for prostate cancer is radiation. And there are a couple of different types, well, there are several types of radiation, but the main ones that doctors use are what we call external beam radiation. And then we have an internal version of radiation, which is sort of seed implants that give the radiation a more localized feel. So it's not encroaching on other glands besides the prostate, which could cause a problem.
I know one of the major questions, and actually one of the most important questions that we have for you is, can men go back to normal after being diagnosed with prostate cancer? Because I think that that's one of the fears.
Yeah, it's a
that
wonderful
men have.
question. First of all, it depends on what normal was before he started, okay? The two major issues with the treatments I just mentioned are erectile dysfunction and incontinence. So can a man return to the sexual function level that he had before any of those treatments? Generally speaking, yes. But because each man is different, in some cases it may take a man maybe 2, 3, 4 months or so. In other cases, it may take a man 1 or 2 years. It depends on how healthy he was before the procedure. Radiation, let me rephrase, I'm sorry. The other issue is incontinence, the ability to control the flow of urine. And that will, again, it will come back over time, but men have to sort of retrain their bladder to make sure that they can keep the urine in without it leaking inadvertently, okay? So those are the two major issues. Yes, men can come back to some level of normalcy after that. Depends on the man and what condition he was in before the procedure. Depends on the procedure he chose. It depends on the skill of the doctor. There are a number of different variables. Beyond that, for radiation, you have similar issues, but one of the other issues with radiation is, again, if it affects the bladder or the rectum, it could cause some other issues with those glands in addition to the prostate that could cause some very severe quality of life issues for men.
Interesting. So we're almost finishing the interview, Mark.
Yes, I have so much more I'd like to say.
I know. I think we should have another interview as a second episode.
I'd love to come back, absolutely.
But also, I want to ask you before we close the interview. It's like, what is your recommendation for our audience, people who are watching this interview, especially for men?
Yeah. So the recommendation is for men that are interested in maintaining their prostate health, I would suggest that you have what I call a baseline test, which is your very first test. Have it before the age of 50. Because the trick with maintaining good prostate health and not having and not dying from prostate cancer is to catch it early. What that means is you want to know what your status is before you turn 50 years of age, because that will then dictate what you should be doing from that point. And it will give you the best opportunity to intervene on potentially lethal prostate cancer early enough so that it doesn't kill you. Okay. From there, I'd say, just continue to build your information. There's lots of websites out there. The American Cancer Society has some great statistics and some great tools to educate men. A couple of other ones that come to mind. There's the Prostate Cancer Foundation that actually does a lot of funding for research for prostate cancer, which is a great source of information. For men of color, which is African American and Latino men, I would also suggest the Prostate Health Education Network, because that's a group that does a lot of what the other groups do, but they're particularly focused on men of color. So the way that they present information is much more geared toward men of color.
Excellent.
Those are some resources that people can take advantage
If people want to, for example, reach you out, there is any way of website or email or phone number they can
you can
contact
certainly contact me at the Boston Public Health Commission, mkennedy@bphc.org, or you can go to the Boston Public Health Commission website, which is www.bphc.org. We're going to begin to populate that website with a lot more information about prostate cancer, but I think you'll notice going into next month, which, so your public is aware, is Prostate Cancer Awareness Month.
in September, right?
In September, right? So we'll be featuring a lot of content, we'll be featuring a lot of social media activity, things of that nature. So we hope that it will be a fun way for people to engage with the commission.
Well, thank you so much, Mark. It was a pleasure to have you here, and
It's
especially
always a
learn
pleasure.
so much about how we can prevent, well, especially men, how they can prevent prostate cancer, and actually how they can have a healthy, better way to enjoy life.
And women can help men prevent prostate cancer as well by encouraging them to go to the doctor and supporting them through that process.
That's for real. Thank you so much. So remember, you're watching Color Latinos TV. If you want to watch this interview in YouTube, you can access Color Latinos TV and our channel. Also, you can email us in our website, www.cltv.com. And we're going to bring more information for you after this break. Thank you.